Okay, this video is why are black women so fat? If you look at the percentage of obesity in America, by far the fattest group of people are black women. Okay, here it is. Women, non-Hispanic black women, they're the fattest by far. And my personal experience is consistent with that. So I asked myself, I just noticed that. I go, why is that? Okay. And number one, I also noticed that black women tend to be a lot fatter than black men. Okay, for whatever the reason. I sort of noticed that if you walk around any hospital in the Western world, you see a lot of black secretaries, black clerks. The women, quite often, not always women, but more often than not, women sitting at a desk. And you see a lot of black men doing jobs where they're running around and getting more exercise. Okay, but the diet is by far the most important thing for whether or not somebody becomes fat. And in my experience, from the black women I know, they tend to eat a lot of meat. They tend to eat a lot of fried foods. When you eat fried foods, those are both very high-fat foods. The higher the percentage of calories from fat, the fatter the population gets. Okay, the next thing is fats have a tendency to undergo lipid peroxidation, and that's whole cascade of reactions leading to toxic aldehydes like hydroxynonenal and subsequent injury to the pancreas beta cell, so a predisposition to diabetes. In addition, it'll damage the arcuate nucleus in the hypothalamus of the brain. This is Tetsumori Yamashima, MD, PhD, Japanese neuroscientist who figured out all this stuff. Okay, so when you injure the arcuate nucleus, hunger center in the brain, you're predisposed to decreased ability to control hunger and then more permanent obesity. Okay, maybe it has something to do with the soy baby formula they drink as babies more often. I don't know for sure about that one. That's a complex subject. I'm not going to get into that right now. That's just been one thing that was hypothesized. Another thing is eat a lot of processed food. Processed food tastes very good. They put a lot of sodium in there, salt, tastes good, so you eat more of it. They put a lot of MFG, manufactured free glutamate, tastes good, so you eat more. The companies do something to test the bliss point to where the person likes it the most, so they will eat the most of it, become addicted to it. Okay. They'll often drink tap water. Tap water that's completely unfiltered has tons of estrogenic chemicals in it. It's got oral contraceptive pills like ethinyl estradiol. One woman voids them out. They go in the water. Municipal water filtration typically does not remove them fully. It's too expensive to do so, so they're in the water. Okay, another one drinks it, and they tend to cause weight gain. Phthalates, BPA, aluminum is a metalloestrogen, is put in water as a so-called clarifier. So anyway, somebody drinking tap water is exposed to a lot of estrogenic chemicals, and that can make you gain weight. Because I see a lot of times overweight women walking around with a big, gallon jug of water, trying to lose weight drinking water. But if that same water you're drinking is full of estrogenic chemicals, estrogen's a fat storage hormone to get you to store more fat while you're pregnant. Estrogen levels go up when you're pregnant. Store that extra weight for the baby. You might need it for energy. Well, you're predisposing yourself to be fat if you're drinking a lot of estrogenics. Okay, personal care products typically have estrogenic preservatives in there, things like parabenzoic acid, parabens, and all that, because they're antimicrobial, but they're also estrogenic. Okay, increased estrogenics will predispose to weight gain. Okay, high estrogenics will also increase the rate of breast cancer. Black women have increased rate of death from breast cancer. High estrogenics will also increase the rate of fibroids. So what I'm doing here is showing why this theory is consistent, because they also have increased risk of death from breast cancer, increased risk of fibroids. That goes with the estrogenics being present in higher amounts, increasing their risk of obesity. Okay, they also have increased risk of some autoimmune diseases like lupus. Again, it's all internally logically consistent. So when you see something that's just saying consilience increases resilience of the idea, meaning that consilience means a bunch of small things pointing in one direction. When you see them all together, that makes it more likely it's correct. If there's only one little mild thing, you go, well, that might just be by chance. But when there's multiple things, which each individually might be mild, but together in aggregate, they add up to a lot, to being significant, you should take it seriously. So this is all good news, because when you read the internal medicine textbooks, they stink, okay? Internal medicine textbooks are a joke. They stink, okay? I'll say that to the face of any internal medicine doctor. When I say it, they laugh because they know I'm right. I'll say it to the Harvard chief of internal medicine and endocrinology. Your textbooks are a joke. You're a bunch of liars. I think you guys are all full of crap, the Ivy League internal medicine and endocrinology. And the reason I say that is because what do all these books say for almost every single chronic disease? Well, it's associated with aging. You know what? It seems that it might be part genetic, and then they say, well, it might also be partly due to an infection, maybe a virus or something, and then you know what else they say? Oh, the reason why some diseases are more common in blacks, it's because of racism. Racism. Oh, give me a freaking break, okay? I'm a Hispanic, okay? I got black people in my family, all right? The reason they're eating junk food is not because of racism, okay? It's because it tastes good, all right? You know, they got more opportunities offered to them than any other group in America. All right, so anyways, let's get back to this. But well, I'm not going to get into that. That's a whole other subject. But I want to talk some more about this because there's some other insights in here that I think are useful. What I'm basically saying is these women could be cured pretty easy if they listen to this lecture. Okay, high rates of fibroids mean they often go for hysterectomy. I've had black women tell me every single woman in their family had to get a hysterectomy before the age of 35 because of fibroids. And I see tons of fibroids in my clinical work. Okay, hysterectomy before age 35, not good. The woman has then increased risk of hypertension, coronary artery disease, cerebral vascular accident, a stroke, congestive heart failure, dementia, early death. When I look at a brain of a female and she's demented at an early age, the first thing I check is, first of all, does she got the usual suspects? Is she a smoker, drinker, drug addict, head trauma? Those are the common causes of dementia in young age. Or if I don't see any of those, then I look at her OB-GYN note. And did she ever have a hysterectomy? And that's what I typically find. If she doesn't fit the usual suspect pattern, then it's usually because she's got a fibroid before the age of 35. Because then she stops menstruating, and then her hematocrit starts going up. She becomes like a man in terms of her blood hypertension physiology. Okay, she gets more hypertension. That's the main predisposition to atherosclerosis and stroke. Okay, let's see. We got a bunch more stuff here. Here is basically the further south you go in the USA, the more fat people you have, because I think it's because they eat more fried foods out in the southeast. Now, here's the breast cancer data showing that black women have more death from breast cancer. White women have a lot of breast cancer, but a lot of white women breast cancer is sort of what I would call fake breast cancer because they go for all these mammograms, and mammogram is kind of stupid. I've talked about that before. You know, Gotsky, the Cochrane Collaborative researcher, best mammography statistics guy in the whole world, says mammography should be banned. It shouldn't even exist. Okay, but it does. And anyways, they get more death from breast cancer. Real breast cancer, okay? Which is consistent with a lot of estrogenic exposure. Okay, then here's the next thing. Here's fibroids. This is in black women. Look at that. They get way more fibroids than other ethnic groups. I think it's because they're exposed to tons of estrogenic chemicals. Okay, here's fibroids in the uterus. So here's the fallopian tube going to the ovary. Here's the fundus of the uterus. There's a fibroid projecting a little bit exophytically, but its epicenter is in the myometrium, the muscle of the uterus. And here's in the body of the uterus and the cervix of the uterus. Okay, so those are fibroids. Super duper common. It's a benign tumor of the uterus. Okay, here's a paper by the Mayo Clinic lady over here. And they had over 2,094 hysterectomies. And what they found after waiting 22 years for follow-up, that's a long time, they found that the women who had hysterectomies, especially before age 35, more hypertension, more obesity, more cardiac arrhythmia, more coronary artery disease. And I have other papers where they get more dementia and whatnot. Okay. It's a big study, over 2,000 hysterectomy patients. Okay, here's some other study, and this one is another Mayo Clinic separate study. More cognitive impairment, more dementia in the women who had a hysterectomy, and it's even worse if they took the ovaries out. Bilateral ovaries worse than one ovary. So, and the younger the age, the more problems she got because she loses that protective effect from hypertension. Okay, another thing too is why you got to eat your fiber if you want to be optimal in your health. And so here what's happening is, let me get my picture off here. When you have high estrogen in your body, the liver is your detoxification system for estrogen and other chemicals. It conjugates them to what's called glucuronic acid. Just think of it as being glucose with a carboxylic acid. There's a little more to it than that, but that's good enough. Okay, it makes it more water soluble. Bile is more water-like than people think. So it's excreted into the bile, goes into the bile, and then normally you should defecate it out. And that's how you remove the excess estrogens from your body. But when you have bad bacteria, good gut bacteria eat fiber. So the more fiber you eat, the more good gut bacteria you'll have in your colon. If you don't eat dietary fiber, and blacks tend to eat a very much of a processed food diet, very low on plants. That's an important point. Blacks tend to eat a diet very low on plants. So because of that, they get more of the bad bacteria that have more glucuronidase enzyme, and it will deconjugate this estrogen such that once it's deconjugated, the estrogen is reabsorbed into the blood, and it raises the woman's estrogen levels, thus predisposing her to death from breast cancer, which we talked about, predisposing her to breast cancer, predisposing her to obesity, predisposing her to autoimmune diseases. Autoimmune diseases are much more common in women. 80% of them occur in women. And, increasing estrogenic chemicals is thought to increase the risk of estrogenic chemicals. So all these problems, there's an explanation. So that's why you always want to look, what is the true, real explanation? Because this is something you can fix. Avoid this stuff. So the point of this lecture is to realize there's hope. You're not just screwed. It's not genetic. It's not racism. It's because of your diet. And this is a totally fixable thing. Okay, the next thing is a lot of times they don't eat organic food. The non-organic corn is sprayed, GMO corn sprayed with atrazine. Atrazine is a thing, and it was a black guy who figured this all out. Here he is, Tyrone Hayes. Brilliant guy from Harvard. And guess what? As soon as he figured this out, did they celebrate and say, congratulations, great achievement? No, they said, hey, you jerk. Why are you telling the public this stuff? We're going to take away your funding. We're going to take away all your support. We're going to get you fired from your job. So that's the thanks a guy gets when he does something good for the public, If you lie to the public and tell them, yeah, statins are great. They should be in the drinking water. Yeah, give that asshole $1 million. But, you actually find what's making people sick. They try to fire you, take away your funding, and cover up the findings. So anyways, this guy, Tyrone Hayes, he showed that atrazine feminized the exposed males. It turned the young male frogs into females, okay? It's estrogenic. It's super powerful estrogenic. Not only that, it's a mitochondrial inhibitor. It's going to lower your metabolic rate. That might also predispose to obesity. And look at this. They said atrazine is the most commonly detected pesticide contaminant of ground, surface, and drinking water. It's super common because they use corn all the time. They spray this junk atrazine on the corn, and then the corn is used to make high fructose corn syrup, which is in tons and tons of processed food. Not to mention they're feeding this GMO corn to the cattle, and you get these things accumulating in cattle when you eat meat. And guess what? It reduces spermatogenesis and it lowers fertility. Okay, isn't that great? Yeah, I'm sure they're not trying to sterilize you. Yeah, right. Sterilize the native population and then open the you-know-what down south, what borders, okay, right, and replace us all. We all know what's going on. Okay, so here's a little bit about atrazine, and it's a mitochondria inhibitor. So again, that decreases your metabolic rate, might predispose you to obesity, and it's also increases the risk of infertility. Isn't that nice? And now you're going to hear all these people say, oh, soy is so wonderful, soy is so great. And here's this lady, and I like her. She's actually nice, and I actually think she's pretty bright as far as, surgeons go. This is a lady, what's her name? Christy Funk, okay? But I just want to let you know something she said. She goes, oh, soy is not an endocrine disruptor. There was a big study, and it showed that there was no alteration of thyroid function, estrogen levels, ovulation in women, semen in men, all this stuff. And she cites this paper by this author named Messina. Well, here's Messina. He's the head of the Soy Institute. I wonder if maybe, just maybe, the paper's biased. And besides the soy being intrinsically estrogenic, and there being a lot of problems with it, especially when you look at the papers before all the industry funding came on board, they often process it with hexane, which is a toxic substance. Okay, we're not going to get in that right now, but a lot of times what happens is, okay, so here's a paper by Messina about how wonderful soy is, the guy who runs the Soy Institute. A lot of times when they'll switch out soy for dairy, and dairy is a disaster for health. Soy's bad, but dairy is a disaster. And by comparison, this will make soy look good. That's one of the reasons why it'll sometimes look good in some studies. Okay, we alluded to the fact you need to get your dietary fiber. Okay, so dietary fiber feeds the good bacteria with the smiley faces. They make butyrate. Butyrate is used by the lining cells of the gut, the enterocytes. It's called the enteric tract. Cyte means cell. Enterocyte means gut lining cell. So these tight junctions prevent anything from getting across here that shouldn't get across here. When you don't eat dietary fiber, you can't make the tight junctions, and now you can get all kinds of toxic stuff coming across here, including big chunks of protein that can cause molecular mimicry with autoantibody cross-reactivity. The bottom line is they cause autoimmune disease. That's the mechanism. I have entire lectures on leaky gut if you want to watch them. Okay, so why does that matter? Because, well, guess what? Black women have really high rates of lupus, okay, which is a very severe autoimmune disease. Some friend of mine died from that when I was young. I didn't know any better what to do. So anyways, blacks got a really high rate of lupus here. Okay, so anyways, what I'm trying to say is it's all coming from the same thing because they're eating a processed food diet with tons of estrogenics, and this could be prevented. They could really make dramatic improvement by learning this. And so instead, you go to the universities. The doc doesn't know any of this stuff. Nobody teaches them stuff. It never gets into popular culture, popular press. Well, I'm telling you the answer there. So there's some hope for black women and for all women. You can avoid all this stuff pretty easy and dramatically improve your health. I hope this is helpful.